Thanks to Weist and George Mason University for organizing this very important event. And I recognize I'm the final barrier between you and lunch, so I'll go fast. This has been a major focus of my career for 19 years at University of Maryland and 5 years now at South Carolina. It's a pretty simple idea. Over here you have the mental health system, and most people don't go to it. There's just many barriers that get in the way of children and adolescents, families, getting the mental health system, stigma, transportation, funding, on and on and on. Over here you have the schools that are under-resourced for this work. We have great people, school psychologists, counselors, social workers, nurses, others, but they're far below the ratios recommended by the professional organizations. And we also have these position constraints which limit their effectiveness. So school psychologists, for example, are able to do intervention, prevention, but can be constrained into roles of evaluation. School counselors can be constrained into roles of academic advisement. So can we do this in a new way? Can we move the folks out of their offices in community mental health into the schools to support the work that's already going on? And there's a literature that's emerging on the number of advantages for this, tremendously improved access to mental health services for youth in need by moving the mental health system into the schools, improved early identification and intervention, especially for youth with internalizing issues, youth who are depressed, anxious, struggling with trauma. We do a much better job of reaching these youth through school-based programs than relying on them getting to clinic settings. And also we see improved outcomes. With a big caveat, though, of when done well. We don't want to see the clinician from the mental health center come into the school on Tuesdays and Fridays and no one really knows what they do and same old practices. So we've got to focus on when done well. And in addition, school mental health has been pretty ad hoc. It varies. In a district, you might find a private practitioner in a few schools, the mental health center in a few others. Most of the schools don't have any mental health system involvement other than the school employees. So it's very ad hoc, and it lacks an implementation structure. So Catherine talked to you about PBIS. My whole career has been in the school mental health world, and for the last 6 or 7 years, I've been recruited into this world. It's now actually in more than 20,000 schools. Catherine reviewed some of the major aspects, database decision-making, focusing on evidence-based practice, focusing on systemic implementation, and as Catherine indicated, many positive outcomes for PBIS. Again, with the caveat, when done well. You'll go into some schools with slogans on the wall. That's not doing PBIS well. And in addition, we see progress in PBIS often at Tier 1, but schools struggle in that triangular framework to do more at Tier 2. Tier 2 really early intervention, Tier 3 being treatment. Schools struggle with that. Now that's where this partnership comes in, because mental health is often operating mainly at Tier 3. Can we join together to create depth and quality at all 3 tiers? So instead of having these 2 major movements, and the United States is the world leader in both of these areas with significant federal support, but they've operated very separately. Can we instead join together and have one thing, not 2 things? The PBIS people, the school mental health people working together. As I come into a school as a clinical psychologist, I don't refer to myself as part of the mental health initiative. I'm just on the PBIS team. It's one thing, not 2 things. And by doing this, we really can create a platform for school safety and violence prevention as we focus on working together effectively, creating economies of scale, creating some synergies. This is a monograph on this topic that you can find on the PBIS.org website, where we go step by step how to do this work at a building, at a district, at the state level, how to use data, how to build teams, how to integrate mental health and PBIS together. So I'd recommend that you check out that resource at PBIS.org. I'm very grateful to live in the United States and very grateful for the federal support. In 1995, when I was newer in my career, HRSA actually funded us for a National Center for School Mental Health, which is continuing. I'll tell you about that in a minute. But many terrific documents. Bill presented some of the history. We can't just look forward. We have to look backward to some of these great documents, and these are just some that I'd recommend. And you can see all the different federal acronyms very grateful for federal support for school mental health and PBIS. These are two conferences that are coming up that I'd recommend. One called an Implementers Forum for PBIS. It's always in Chicago. There's the website. And the 20th Advancing School Mental Health Conference, organized by the Center for School Mental Health, which I helped to start in 1995, now directed by Nancy Lever and Sharon Stephen, will be in New Orleans in early November. I'd highly recommend that. And finally, these are global themes, so I'm fortunate also to connect to these discussions around the world. I'm part of a group called the School Mental Health International Leadership Exchange, and I've been part of a series of conferences on mental health promotion that started in 2000 and have moved around the world. We're very privileged to be actually hosting this conference in South Carolina in September, and you can see some of our keynotes, including the famous Dr. Bradshaw there. And these presenters all will be reflecting the themes that we're talking about today. So I'd encourage you to check out the conference and join us in sunny Carolina in September. Thank you very much.